Hello, and welcome to our show. My name is Dr. Reed Tuckson. I'm the former Commissioner of Public Health for Washington, D.C., the co-founder of the Black Coalition Against COVID, along with our colleagues at BDO, and I'm chair of the board of the Coalition for Trust in Health and Science. Welcome to our program, A New Year, Healthier You, the Power of Adult Immunizations. I'm pretty sure that what unites us all is the desire to be maximally healthy, especially as we get older. And what unites us is the need for trustworthy information and access to credible experts to help us make our personally appropriate decisions along our health journey. And that's what we're here to do today. It's my pleasure to welcome you to this important discussion, a discussion not only between our panelists, but also a discussion with you. And so I encourage you to put your questions in the question section. If there are things that are of particular interest to you and we have not yet covered it, we'll make sure that by the end of the program, we turn our attention and speak to those issues that are on your mind. Before we begin, I'd like to thank our sponsor, Bio, the place where breakthroughs begin. These are challenging times for people who are trying hard to make the most personally appropriate health choices for themselves, their families, and the communities in which they live. There's a lot of confusing information, and unfortunately, a lot of untrustworthy information that can cause people to fail to take reasonable and safe actions to safeguard their health and that of our families. All of us as adults, to some extent or another, really do want to live our lives as healthy and as productively as possible. Unfortunately, too often we aren't aware of some key health recommendations or the importance of complying with them. Adult vaccination is one of the most important of these, and that's what we're going to address in this program. We're going to discuss what adult vaccines are, why they are important to every adult, and why they are especially important for some people, how they participate in the process of healthy aging, their special relationship with addressing disparities in health outcomes, and practical tips on keeping track of vaccination recommendations, among other topics. And we have an outstanding panel of experts for this discussion. Joining me is Dr. Kelvin McCoy, a physician who earned his degree at the UNC, University of University of Carolina at Chapel Hill. He is a senior regional medical director for Dynavax and has 15 years of experience in various roles in the life sciences industry. We're happy to welcome Dr. Candace Robinson, a board-certified pediatrician with 15 years of experience in vaccines and public health. She received her medical degree from Wayne State University School of Medicine and a master's of public health from Vanderbilt University. She serves as the Director of Scientific Affairs and Public Health for U.S. Vaccines at GSK. We're happy that we will eventually be joined by Christian A. Feimster, an associate professor of pediatrics and infectious diseases at the University of Pennsylvania and the Children's Hospital of Philadelphia. She received a medical and public health degree from Columbia University and specialty training at the University of Pennsylvania. She is currently the executive director of Global Medical Affairs for pneumococcal vaccines in the Vaccines and Infectious Diseases Division of Merck Research Laboratories. And we're finally joined by Dr. Allison Hill, a PharmD, who is the Director for Professional Affairs at the American Pharmacists Association, where she leads initiatives that advance sustainable pharmacist patient care services. She received her PharmD, or her Doctorate of Pharmacy, from the prestigious Howard University College of Pharmacy, and currently serves on the District of Columbia Board of Pharmacy. Well, let's get right to it. And perhaps we can start off with you, Dr. Robinson. Why do so many adults think that they don't need to take a vaccine like they did when we were children?
Yeah, that's a great question, Dr. Tuckson. I think we've seen that surveys have found that many adults are unfamiliar with many of the vaccines recommended for them. And physicians indicate that most adults are unlikely to receive many of the vaccines they recommend. For example, the CDC recommends that adults stay up to date on routine vaccines like flu, COVID, and Tdap. And there may be other recommendations for adults based on their age or health conditions or lifestyles. And so, really making sure people are aware and talking to their doctor, talking to their pharmacist. Vaccines are one of the most important tools we have to protect against vaccine preventable diseases. And that's just as true for adults as it was and is for children.
So let's be clear that we all had our experiences as little kids, and we remember, at least I remember, getting that super special little Band-Aid with my balloon on it or that clown on it. Now, I don't, I noticed, by the way, I'm kind of disappointed, Candace, that when I got my adult vaccines, they don't give me my balloon anymore. But that notwithstanding, you're saying though that even though most of us are so aware of the children's vaccines, but that we just cannot just go to sleep on the fact that there are adult ones.
Absolutely. I think making sure that everyone's aware that, vaccines aren't just for children, they are for adults. There are recommendations for adults, and empowering people to have that conversation with their provider to make sure that they get the vaccines specifically recommended for them.
Well, I want to emphasize that point, Dr. Robinson, that what you are saying is that we really do need to have a conversation with our primary care provider, whoever our medical home person is, and say, I really want to talk to you about this because I was hearing on this show at BDO that this was important. And so in that regard, Dr. Hill, help us to understand what are some of the most important adult vaccines that we should be especially attentive to, and why is it so important that we don't, skip them?
Oh, of course. Well, first, I encourage everyone to speak to their pharmacist or their doctor, their nurse practitioner, or their other healthcare provider about asking about what vaccines they need, age, chronic conditions, and whether or not they are immunocompromised will determine their needs. We are so fortunate to live in a time that there's so many vaccines to prevent diseases and lessen the complications. But according to the CDC, all adults annually should get their annual flu shot. They should get their COVID-19 vaccine, according to the most recent CDC recommendations, unless they have had a serious reaction to a previous vaccine. Adults also need a Tdap vaccine every 10 years, unless they're in a...
I'm sorry, I don't know if I remember what the Tdap is. Can you explain that for me?
Sure. It's the tetanus, diphtheria, and acellular pertussis vaccine. And it's mainly used for the tetanus part is if someone steps or comes in contact with the rusty nail, that's for that protection. And then the pertussis part is what you may have heard as whooping cough. So that's something that adults have to get every 10 years, unless they are women who are pregnant or going to be around young children who are not able to get that particular vaccine. So those are the top three I would say are the most important that as adults we need to make sure we're staying on top of. But then depending on their age or chronic conditions, adults may also need a Hep B and HPV and meningococcal.
I'm sorry, that Hep B, what was that one again?
Hep B. Okay, I will slow it to Hep B, a hepatitis B, also an HPV, a human papillomavirus, a meningococcal, an RSV, which recently came out, which is respiratory syncytial virus, and a zoster, which most of the time people will say, well, that's the shingles vaccine.
Well, that's quite a bunch there. I want to unpack something you said that I thought was very important, and that was you said that we should talk to the pharmacist.
Yes.
Now, look, I go in the pharmacy and they are rolling back there. I mean, there are all kind of people moving in all kind of directions. They got the drive-through lane that some people are serving, and then you got somebody that wants to come to the pharmacist desk and purchase their Tide dishwashing liquid. I mean, so there's a lot going on. Are you saying that I should not feel intimidated by all this busyness, and actually it's okay to stop them and say, look, I want to talk to you about my vaccines?
That is perfectly okay. I have worked in community pharmacy for over 12 years, and I would much rather have someone come, stop, ask as many questions as they possibly have about a vaccine in order for them to get that vaccine. so many times lack of information is the reason that people are not getting their vaccine. And we definitely in the pharmacy have that time to educate.
Well, you've given us a good list of some of these, and we're going to come back to those in a minute because there are a couple that I really do want to call out and dig deeper in. But for the moment, Dr. McCoy, Dr. Hill sort of indicated that there may be some special groups that need to be especially vigilant in getting these vaccines. What would some of those people be?
Right. So I immediately think about three special subgroups here. Subgroup number one equals older adults, in particular senior citizens. And then subgroup number two, I think about adults with chronic medical conditions. And then subgroup number three, I think about adults who need to get caught up on vaccines that they should have received as a child or adolescent. And so we know that, as we become older adults, our immune system tends not to work as well. We know that there are certain chronic medical conditions that suppress our immune system. For example, when we think about diabetics versus non-diabetics, right? Diabetics are twice as likely to contract hepatitis B. They're twice as likely to develop long-term complications from hepatitis B if infected, and they're twice as likely to die from hepatitis B if infected as well. And so the other thing we know is that life can be complicated, and we're not always able to visit the doctor and get vaccinated when we're supposed to. And this is true even as children. And so, for these reasons, I think that timely receipt of recommended vaccines is important in order to maximize our chances of having the best immune response possible.
This idea of being sort of immunocompromised, you said, can you just give us a little bit of a better understanding of we hear that term all the time when people make these kinds of presentations, but what does that mean to be immunocompromised?
Right. It just means that you have some sort of medical condition that tends to suppress your immune system, right? It could be diabetic, it could be HIV positive. You could have hepatitis C, for example, but there's some sort of it could be high blood pressure. There's some sort of chronic medical condition that's happening that does tend to suppress your immune system.
I appreciate that. And then when we talk about older folk, I have to tell you that sometimes I forget that I'm always talking to the public about how important it is that older folk get their vaccines. And I forget, wait a minute, I'm one of them. So what does the word older mean?
Yeah, I think it can be kind of subjective. But, in my mind, when I think about an older individual, it could be someone who's 55 and older. It could be 60 plus years of age. It doesn't necessarily mean someone that's 80 plus years of age, or 85 years of age, like your great-great-grandparent. So exactly. So I think there's a lot of people that could fall underneath that umbrella of an older adult, if you will.
So all y'all folks who don't be ashamed that, we play age games, I still feel young. I still feel vigorous, but I have to admit I'm in that older group. And so I've been taking care of business for myself, and I hope others who are in my cohort will do the same. Dr. Feemster, you can help us, I think, to understand a little bit about how vaccines, like some of the ones that Dr. Robinson mentioned earlier, vaccines for pneumonia or shingles and hepatitis B, how do those things really help prevent serious health complications and support healthy aging?
Yeah, this an excellent question, and really important, to remember and make sure we emphasize the benefits of vaccination and how they can contribute to our health. And of course, vaccines they prevent infection, and if they can prevent an episode of illness or an infection, they can help keep us out of the hospital. And they can help prevent death. And, for certain infections, they can even help prevent the exacerbation of chronic conditions. And so I think pneumonia is a good example. Respiratory infections, for older adults especially, they're at increased risk for having a more serious respiratory infection, more risk for hospitalization, and a higher risk for potentially mortality associated with an episode of pneumonia. And so if we can prevent a pneumococcal infection or influenza or COVID, we can prevent potentially an episode of pneumonia and prevent a hospitalization. We really have an opportunity to support healthy aging Absolutely. And I think pneumococcus is another good example of an infection that has been shown, episodes of hospitalized community-acquired pneumonia have been shown to increase the risk for different cardiovascular complications. And so, by vaccination and, preventing an acute episode of an infection, we can have longer-term implications for the development of chronic conditions, also really important for healthy aging. So I think there's so many ways in which these vaccines can really be critical in the short term and the long term. I think hepatitis B, of course, is linked to increased risk for cancers. Many of the vaccines that we have, the vaccine preventable diseases that we have an opportunity to reduce, really can have a significant impact.
I really like the way you responded to that. Because what I hear you saying is, I know so many people think about getting the vaccine to prevent like a short-term acute problem. Like, you don't want to get the flu. So let's just get that vaccine. We don't want to get the flu and then be done with it. And what you're saying, in addition to that, if I hear you correctly, Dr. Feimster, you're saying that these vaccines can also prevent us from getting chronic illnesses down the road by having a complication from the disease itself that then leads to other problems which you really don't want. So is that really what you're trying to get at here?
That's exactly right. And that's exactly right. So this opportunity you have for prevention, does have our short-term implications, keeping us out of the hospital, keeping us at work, keeping us with our families, but also can have longer-term implications as well.
Now, I want each of you to go ahead and anybody can jump in from this point on. I'm not going to call on people, but I want to start to understand a little bit about how do we explain to people what a vaccine is? How do we just, in very straightforward terms, explain the difference between a vaccine and a medication? Who wants to take that on? Good, Allison. Yes.
I'll start with just a little tagline: is vaccines prevent diseases, or they lessen the complications of infections if you were to actually acquire that particular infection.
Good. Kelvin, I think, is that you?
Yeah, that is me. So, I would jump in and I would add that, when I think about vaccines, maybe one way to describe it or explain it is that these are items, or these are things that stimulate our immune system to recognize and fight off like those specific infections that we've talked about already this evening. And, maybe I'll just take this opportunity. I know we talked about adults with chronic medical conditions earlier, but maybe this question is, a good opportunity to kind of reinforce the importance of vaccines for all adults, including otherwise healthy adults and not just adults with chronic medical conditions. And so the last thing that I'd probably submit right now is that, timely receipt of recommended vaccines, that is a big factor in support of healthy aging overall, and just reducing that risk of sickness and hospitalizations from a vaccine preventable disease as we get older that Dr. Feimster was talking about.
Great. And so, the difference, of course, also is that, when we get a medication, so often it's a pill that we can take. These vaccines is a shot. But what you're saying is that this shot stimulates some part of our body's naturally protective system and puts it into overdrive, so that when a new insult, a new invader comes in, that the army is organized and ready to go to attack it and get rid of it. Is that a reasonable way to look at it?
Yeah. And in fact, often, especially with kids, because I'm a pediatrician, often will use that same metaphor related to army. You really are kind of building your army to fight infection. But I think another important part of the message is, as Dr. McCoy said, that vaccines are something we take when we're healthy to keep us healthy. And that is an important message.
And by the way, for those in the audience who I know are going to ask this question, let's get it dealt with right away. Is it important that we also do other things to boost our immune system and protect ourselves through eating properly, sleeping properly? Are those important, but also, is it enough by themselves?
Yeah, I think, it's all important. And, vaccines are just another part that play a role in that health over time. Vaccines play that role in being that tool to help protect us against vaccine preventable diseases, but it's just another part of things that we do in addition to everything else that we do to stay healthy as we age.
Excellent. Now, we know that we are in a challenging time with lots of misinformation. And there are folk who are running about the country who are saying that vaccines can be dangerous, that they're not safe, they haven't been studied effectively. Who wants to help our audience understand the what goes into making sure that these vaccines that have been approved are actually not only effective, but that they're safe?
Well, I mean, one, important message, I think it is really important to understand that there is so much that goes into the development and approval of a vaccine, and that being able to demonstrate its effectiveness, but also safety is a critical component of that approval process, and that it's taken very, very seriously. And so considerations about safety are part of vaccine development from the beginning, and even after approval continue to be a part of the ongoing monitoring of all of the vaccines that we use. And so it is important to recognize that it is a really critical part all along the pathway.
I think that let's make sure that we emphasize that once a vaccine has been approved through rigorous studies, approved by two different scientific bodies that have to look at that, somebody from a group of external scientists from the FDA and external scientists associated with the Centers for Disease Control. After all of that is done, then there is a monitoring system so that if there are any things that start to go wrong, signals that show concern, then that can be addressed by, again, these special scientific bodies. And so I hope that people understand that these are extraordinarily monitored instruments that we have available to us. I noticed when we first started out, we talked about the number of vaccines that are out there. When people are taking more than one vaccine, is there a concern that you have to be aware of any interactions between these that could cause harm? Yeah, Candace, looked like you're getting ready to say something.
Yeah, I think that, with people, really the important part is making sure that you talk to your doctor and your pharmacist and your healthcare provider to determine what's recommended for you and when to receive the vaccines that are specifically recommended for you. Everybody has individual providers, individual indications for vaccines, as Dr. McCoy has pointed out, based on their age or their health status or their lifestyle. And so all of these things, your provider can discuss with you what vaccines you need and how your plan for making sure you get the protection you need.
Mm-hmm.
I want to pay special attention during this time of the year. We are doing this program here in middle of January, which is still the season for flu. It is still COVID season. Unfortunately, COVID season has now become year-round. And we heard earlier in the conversation the importance of getting our COVID vaccines, but the new recommendations are, because COVID is going around all year, that we may be for those who are elderly and those who are immunocompromised, may need to be talking to their doctor about getting their COVID shot more often than we have recommended in the past, perhaps every 6 months, or if not, maybe even a little sooner. Is that important? Is that still the guidance, and is that still important to listen to? And it looks like you all are agreeing by your silence that it is. And so I'm going to reemphasize that point, that you really do, if you are a senior, be in touch with your doc. I heard, we also know that right now there are 3 recommendations for adults during this time of the year that are especially important. And that is, of course, COVID, that's flu, and that's RSV. And I wonder, can you tell us, is it okay to get the flu shot and the pneumonia, the flu shot, the COVID shot, and the RSV? Can you get those all at about the same time? Allison?
Yes, you can. CDC, Centers for Disease Control, they actually put out recommendations where they have studied that it's okay to get those at the same time. I know sometimes people can get a little anxious about getting so many vaccines in one arm. There's options where you can get one or two in one arm, or get another one in another arm. It's just whatever you feel comfortable with, but those are okay to get.
Great. And someone I heard earlier, we talked about something called the shingles shot. Any of you want to mention what that's about? What that disease is?
Yes.
Yeah.
Yeah. Sorry, I didn't know if I was on mute. But shingles is a rash illness that can cause kind of painful blisters or rash in persons who get shingles. And once the rash is gone, some people experience what is known as post-herpetic neuralgia, which is a painful complication that can last for several months, and in rare cases up to several years. Post-herpetic neuralgia is one of the most common complications of shingles, and occurs in anywhere from 5 to 30% roughly of people who have had this a painful rash illness.
I will tell you that I have treated people with this disease, and it is very common to get shingles. Again, it's this disease where when you've had chicken pox as a kid, this is really the kind of things, right? Isn't it? That when we have some of these diseases that happen in childhood, they don't go away. They stay with us, and this little virus sticks right in there with in our neurons, and then for some reason it will reemerge in adulthood and give this shingles. The way I've heard people talk about it is even just having your shirt brush against your skin is excruciating pain, and so this is a disease that can affect your eyes. It can affect your face. I mean, it really is a very very difficult disease to manage once you get it. So this is one disease, one vaccine that I really would urge every one of you, make sure you get it. And there are different versions of this vaccine for people at certain ages. And so especially as you get older, there will be stronger ones. And so please make sure you talk to your health provider about your shingles vaccine. Is there any one that any of you also would like just to repeat again how really important it is for people to pay attention to? What's your pet vaccine? Kristen?
Well, I think it's also really important, because I think we do talk about the vaccines that we need every year for COVID, influenza. We have the newer RSV vaccines, but and shingles, of course, important. But pneumococcal vaccination, and I think also really important to make sure that our adult community remembers as well, because of some of the things that we've discussed.
Tell me, by the way, as you continue on, tell us what is the pneumococcal vaccine treat?
Yeah, so the pneumococcal vaccine prevents infections caused by this bacteria called pneumococcus. And pneumococcus, it's a bacteria that actually really affects almost all age groups. It's an important contributor to different infections in kids, and it is an important contributor to infections in adults. In adults, the most common manifestation is pneumonia, but it can also cause bloodstream infections, and it also can cause meningitis.
And what is meningitis, by the way?
And so that is, it's essentially an inflammation of the lining around your brain, really is what it is. So bacteria can get into that lining and cause.
Doesn't sound like something I want to get.
No, it is not anything that anyone would want to get. And so, pneumococcal vaccination, can prevent infections from pneumococcus, and then can prevent some of these outcomes. So, I mean, pneumococcal pneumonia is a big contributor to hospitalizations, and I talked a little bit about, some of the other kind of longer term complications associated with infection. But vaccination is recommended for all adults now. The recommendation has just recently been changed, but for all adults 50 years of age and older should get a pneumococcal vaccine. And then if you have certain risk conditions and you're younger than age 50, you should also be vaccinated. And a long list of different chronic conditions, but like chronic heart and lung disease, sickle cell disease is an important risk factor for pneumococcus and other immunocompromising conditions. So it's an important one to discuss with your doctor as well.
Great. Well, one of the things that we need to be particularly attentive to is the misinformation. Oh, I'm sorry, Kelvin.
Dr. Tuckson, can I piggyback
Please,
on
man.
that question a little bit? Because I know that earlier we started talking about some of the non-respiratory, vaccines that are out there. And so I think that many adults are now becoming familiar with the potential cancer risk of a chronic hepatitis B infection, right? And so in much the same way that the HPV vaccine can help prevent cervical cancer, the hepatitis B vaccine can help prevent liver cancer. I think someone touched on that earlier. And so, I just wanted to be sure to mention that, as a matter of fact, the CDC actually has a goal of eliminating viral hepatitis in the U.S. by the year 2030. And the healthcare community at large is definitely on board with trying to help the CDC achieve that goal. So.
Well, we've been talking about a lot of these in that sort of from the point of view of the entire population. But let's now focus in on folks of color and what this means to us. One thing that we learned through the COVID pandemic was that when we first started out talking about vaccines against COVID, we had to deal with all kinds of past historical distrust. The experience with the Tuskegee, the United States Public Health Services experiment, as it really was, on African American male with untreated syphilis, and that was done at Tuskegee. That was a burden, along with many other insults that have caused us to be a little bit anxious about our interrelationship with the health system. Despite that concern and anxiety, once we in the Black community started to talk to each other, once Black health professionals and Black pastors started talking with our community, with our social and fraternal organizations, our church groups and so forth. Once we started to bring trustworthy information from credible experts, we then, for the first time in history, in the COVID vaccine, represented the first time in history we've ever closed a disparities health gap. What most people don't realize, as a result of having closed that gap and doing all the other things that were recommended to be done, Black life expectancy in the second year of the pandemic was better than white America, because we fought hard for our own lives. And unfortunately, in other parts of the country, they said, don't get vaccinated. They told their people, don't do it, and all that sort of business. And unfortunately, and sadly, they died at higher rates than we did. And so I want to make sure that we take a look now at this notion of disparities. What do you see as going on with this disparities issue for these other vaccines? And what's the relationship between our getting vaccinated and closing these disparities gap? Who wants to take that one on?
I can start. I think suboptimal vaccination coverage amongst adults can be further compounded, like you've highlighted, Dr. Tuckson, by these long-standing racial and ethnic disparities in vaccine uptake, reflecting stark health disparities and leading to a disproportionate burden of vaccine preventable diseases among several racial and ethnic groups. And we know there can be many barriers to vaccination. There could be physical barriers, transportation, you can't get to place to receive the vaccine, lack of consistent care, or you have few touch points with the healthcare system. There could be awareness barriers as well. If you don't know, how do you get vaccinated? I didn't know I needed a vaccine. Vaccine specific concerns, but there are also strategies that can be used to address these barriers, like including like the widespread and clear messaging that you just highlighted, Dr. Tuckson, during that time, optimizing access and supporting people getting to clinics, having clinics available, having outreach in multiple languages, having transportation, et cetera. So we know disparities still exist in vaccination, but we also know there can be barriers and there are strategies that we can employ to help address those.
Good. Christian, do you have a comment on this?
Yeah, I was just, going to note, that, in addition to disparities in vaccination coverage rates, there are some, striking and significant different disparities in disease risk, serious disease risk for some of these vaccine preventable diseases. Pneumococcus is one example, and that you can really see some significant differences at the timing of age when the highest prevalence peaks in Black adults compared to non-Black adults, for example. And I think that some of these trends are important to understand because they also really highlight how important it is to ensure that our communities are getting vaccinated. I think one other important point to note is, we've talked about risk conditions, and their association with many of these vaccine preventable diseases. And a lot of recommendations target groups with certain risk conditions. But there are some studies demonstrating that Black adults are less likely to be diagnosed with some risk conditions compared to white adults. And so, may be missed in some ways as well. And so I think also just ensuring that, again, we're following up with our providers and that we are doing what we can to support a connection to a provider so that can support, and address those disparities as well that are really important to build access, and then can help support implementation of these recommendations as well.
Kelvin, I'm going to come to you in 1 second. I just want to really unpack for just a minute a couple of key points that I just heard. I think what I'm hearing you teach us is that, first and foremost, because there is more experience, we have more disparities with chronic illness. We have more frequency of getting chronic illnesses than other population groups in the country. Our health is known to be less good, less well than other parts of the nation. And so that in and of itself says to us, given that if you have a chronic illness, your immune system is compromised, you really do want to make sure you're getting the right vaccines on time for you. But what you're also, I think, saying is that sometimes we don't even know that we have a chronic illness. And so I think what you're arguing for here, Christian, is a sense of viewing vaccines in the holistic concept of overall health. That getting our vaccines straight is one tool in the whole army of things we need to do. And we intersect it, coordinate it inside of our overall comprehensive health condition. That means getting diagnosed for things so we catch them early, and then using vaccines to make sure that we don't take small problems getting worse down the road. Is that really what you're trying to teach us?
Yes, thank you. That is a yes.
Oh, good. All right.
Synthesis of all of those points.
Okay.
But it speaks to life course vaccination. I think that really is considering this whole view.
I like that term. What'd you call it? Life course?
Life course vaccination.
All right. Thank you. Kelvin?
Yeah, I just had a couple of thoughts I wanted to share on this question, because I think that vaccines in general, right, holistically, to use that word, can play a key role with respect to addressing these disparities, because they help to really just reduce that burden of disease in underserved populations and communities of color. And I think the concept of reducing that burden of disease actually segues quite nicely into the importance of preventive healthcare. We talked about that a little bit earlier. And we all know that it's usually, easier and less costly to prevent a disease in the first place than have to treat that same disease. And so that actually kind of leads me to thought number 2, which is around the importance of equitable access, is what I'm going to call it, to vaccines. So it's one thing to have, all of these fantastic vaccines available, but it's something else if major segments of the population aren't able to access those same vaccines. And so I believe that equitable access to vaccines, that's a key component of preventive healthcare. And I think it can be thought of as an equalizer, if you will, with respect to addressing health disparities in underserved populations.
An equalizer. I like that. What Candace was, I think, earlier, a few minutes ago, outlining, that there are ways of enhancing access. And I think you were mentioning sort of like providing, certain transportation services and those kinds of things. Let's not forget that, we're all in this together. And we've been fighting for our survival as a people ever since we touched these shores. And so let's make sure we're taking good use of our church resources, our fraternities and sororities, whatever, our bridge club, our pinochle club, whatever, bid whist club, whatever it is that we do, that there may be somebody that needs a ride to get to get themselves vaccinated. Let's care about whether we live or die. I love the term, Black Lives Matter, but the one thing we got to remember, if Black lives do matter, and they do, they got to matter to us first. We have to do the things that we need to do. Allison, the pharmacies are key role players now in the vaccine drama. Help us to understand, first of all, how did our regular pharmacies become the place to get vaccinated, and what should we know about being able to access that resource?
Well, pharmacies, we're lucky because 90% of Americans actually live within 5 miles of a pharmacy. So more than likely, everyone who's listening to this, you're very close to a community pharmacy that actually does immunizations. Many pharmacies have stepped up in the past 20 years, started out with just pharmacists giving out vaccines. And with the pandemic, student pharmacists, those who are in school, and also pharmacy technicians also became able to give vaccines in most states. Right now, most of the ones that the pharmacy technicians and the student pharmacists are giving are the COVID and the flu vaccines. But all the other vaccines, the pharmacist on duty is able to provide. Another part with access that I do want to mention is a lot of times people may want to find other pharmacies that are close by or that are local that are able to do the immunizations for them. And there's several resources that people can look for. One of them is vaccines.gov, which is produced by the Centers of Disease Control. And also there's also a specific resource that my association, the American Pharmacists Association, has, that if you go to vaccineconfident.pharmacist.com, you can put in your zip code and you can find a nearby pharmacy that you can go and get your vaccine.
Let's review those two sources again, and I'll ask our colleagues at blackdoctor.org to put those on the banner that's scrolling below us. Let's start, first of all, I think you mentioned the Centers for Disease Control website.
Yes, the vaccines.gov. And that one gives you a nearby location that is going to be able to provide a flu vaccine or a COVID-19 vaccine or an RSV vaccine. And
then you said that your organization has one as well. What was that one again?
That is vaccineconfident.pharmacist.com. And it actually has two different maps. There's one that's for providers and there's one that's for the public. And people can put in their zip code and find their local pharmacy that is able to give vaccines.
And I imagine, Dr. Feimster, places like Penn, University of Pennsylvania, other hospitals, do they offer these services as well?
Yeah, through their pharmacies or through, any provider office should serve as a vaccine provider, an immunization provider. So yes, your health system or provider will, offer vaccines as well, and certainly has connections to, the pharmacy network and can help identify community locations for vaccination, in recognition of how important that network is for supporting access to vaccination for adults.
And adults who have insurance and those who have Medicare, almost always these vaccines are covered by insurance, aren't they?
Yes, they are. So it's important that people do have access to their updated insurance information because all of these vaccines are usually covered. The only vaccines that aren't usually covered by Medicare or most commercial insurance plans are those travel vaccines. And that would be something like yellow fever.
All right. So in other words, if you're going on a trip to a foreign country, which is a little out of the norm, that those may be things that you may have to purchase depending on your insurance. But these routine vaccines that are there to prevent illness, those are almost always covered by whatever kind of insurance that we have. And that becomes very, very important. Well, outstanding. So one of the challenges that I know, and I don't know, Allison, if you have information on this, but one of the challenges that I have is, given that we've got so many of these vaccines that are recommended, depending on who we are, our own medical status, trying to keep track whether I got them or not. How are we doing, do you think, or any of you can answer it if you know, but how are we doing on being able to provide people with accurate lists of what we got, when we got it, and what do we need next? Are we doing better as a country on supporting people in that regard?
I'll say we still have some work to do, but there are ways that you can make sure that you're getting that complete list. One option is to make sure that you're getting it in a similar location, or a location that has accessibility for their records. In the pharmacy, for example, there's a questionnaire that everyone must fill out before they actually get their vaccine, and that's asking about their primary care provider and making sure that we're putting that actual name and number or address information of that primary care provider, because the pharmacies are actually required to send that information over to the patient's primary care provider. That way, the primary care provider will have it in their records of the vaccines that were given. Another way that we have that we can check and to see patients' vaccines that they've gotten is via the Immunization Information System, and providers pull that information and can give that information to patients.
Great. Kristen, you were nodding your head in agreement there.
Yes, I was going to note, I think that there has been some progress, certainly, in our ability to document and follow, track adult immunizations, but some work to do. But I think the two main mechanisms, in addition to what's been shared, are these immunization registries. All states do have immunization registries, though there is some variability in terms of how complete they are. But there have been efforts to increase reporting of adult immunizations in many of these registries, and so a provider can access, or a pharmacist to look for the vaccination history when they're seeing a patient. And of course, the use of electronic medical records in many clinics and networks also provides an opportunity to document. So if you are going to the same location, it's easier to track your immunizations. And there have been some efforts, I think, to also link these registries and these electronic health records. But I think also, just as an what we can do is also, as much as possible, ask for a record or a documentation. When I go get my flu shot, I ask for a printout so I have it, especially if I'm not going to get it from my primary care provider, if I've gone to the pharmacy or another community location, and then we have it, and can also have advocate for ourselves when we're following.
Let me review this list, and I think we're sort of constructing a to-do list here. Best guidance. I really like the way you've got it. Number one, and you guys help me out if I don't get it right. Number one, I hear you say, try to go to the same source every time, whether it is the pharmacy you use or your primary, your main healthcare provider. If you stay in your lane, they'll have all the records right there. Secondly, I think I hear you sort of saying that that there is a statewide, almost all the states have an immunization record, and you might want to inquire about whether your state has one and make sure you know how to access it and you're in it. And then third, I would imagine, is keep your own doggone list. So what we heard is you want to go to the CDC site and see what are the recommended vaccines for you. Ask your healthcare provider for what ones you should have. Jot those down and then check off. Okay, I'm good with this. I'm good with this. I'm not good with that. Let me go take care of it. So those are very easy mechanisms. Talking about disparities in chronic disease, one of the challenges that so many of us in the African American community have is chronic kidney disease. Many of us are on dialysis. My own father, I know, was for many years had to be treated with dialysis for his kidney disease. One of our viewers is asking the question that if I'm on dialysis, will the vaccine that I take be washed away? through the process of dialysis. Does anybody know the answer to that question? I think that there may not be an expert on that particular area, but I would find it hard to understand that once you've gotten that vaccine, unless you're being dialyzed that very same day or the next day, I think that might be, it's hard for me to imagine that that would be a problem. But what I would say then, given that we're not experts on that particular question, and everything about our shows on blackdoctor.org is credible, trustworthy expertise. When we know the answer to something, we'll tell you. And if we're not completely sure about it, we'll tell you that as well. So what I would suggest to our listener, and thank goodness for you asking this question, that ask your dialysis provider what the timing needs to be. There's no question you need to be vaccinated. That's not the issue. The question may be one of how soon do you get the vaccine versus when you have your dialysis schedule. So please ask that specific question of your dialysis provider and get that direct answer. Well, we're starting to close down on time, and I think I want to make sure that that we're again really clear about the most important points that have been made tonight. And so I'm going to ask each of you to take actually a couple of minutes if you'd like, but I want you to, as you think now about this, our audience are people who share with you the same desire to want to be as healthy as possible. They want to prevent disease. They want to make sure that their health journey is a successful one. However, I think people know that there's a lot of questions that they have, and they need to have people like you to remind them of what is important. And so let's start, with Kelvin, and then we'll go to Christian and Allison and then Candace. But what are the things that you think that we've talked about today that are the most important take-home messages for our audience?
Yeah, so a few different comments. I'd say comment number one, specific to the healthcare professionals who are listening to the webinar, just a friendly reminder that an HCP recommendation is still the strongest predictor of whether a patient gets vaccinated. So I'll start there.
What was that? A what now?
It's the strongest predictor.
What is
the HCP recommendation?
What is that, by the way?
Healthcare professional recommendation to the patient, to the adult patient, that they receive a particular vaccine at a specific moment in time. So that's my first comment. And then I think comment number two, and this one's around vaccine fatigue. I know that many adults and even many healthcare professionals may be experiencing vaccine fatigue right about now, especially during respiratory season. But I just say vaccine preventable diseases, they don't take a break, so we can't afford to take a break either. And then lastly, I'd just like to give some kudos to the CDC. We touched on the CDC earlier, but just kudos to them regarding the work they do to evaluate the safety and effectiveness of adult vaccines. And, every year the CDC publishes a schedule of recommended vaccines for both adults and children, and that schedule can be easily accessed by anyone online. So those would be my three sort of closing comments.
And on that last point on safety, let's also remind the audience, because again, as people of color, we have reason to be vigilant about trustworthiness. We do. And so I want you to know, and I know the people, that there are African-American physicians and scientists who are on the review panels for the FDA and on the review panels for the CDC. These are credible experts who care deeply about the health of people of color and all Americans in this country. And so we are in the room when the doors are closed, looking out for our interests. And so I think, Kelvin, that is a very important point. Let's turn to Christian and see what her closing comments are.
Well, I think I would, really just emphasize, some of the points from when we started. Vaccines really are such a powerful tool to protect the health of our communities. We have more of them. So we have a broader opportunity, I think, to protect and strengthen the health of our communities. And so it's really important that we take this on, right, and ensure that we are making strong recommendations to our patients, and as people who may be receiving vaccines, to really view this as something that you can do to protect your own health and the health of those around you, and really that this is an opportunity to ensure that you can keep doing the things that you love doing, and I think healthy aging is a really powerful message and important goal. That is the objective. It is really about maintaining the health that we are experiencing today. And I think also related to the discussion that we've had related to kind of misinformation, or really just trying to disentangle all of the information and messages that we hear about vaccines and what to do. I think really important to make sure that you do have a trusted source you can go to ask your questions. Please ask questions. It's really important to do, but make sure that you know where you can go to get credible information. And there are some resources that list credible sites, but I would say those are my closing.
I'm just really still laughing about, this notion of, you give the sense that, look, when you're an adult, you're ready to have a little bit of fun. You want to age so you can hang out and do all the things you wanted to do that you've been saving up for when you were younger. And now you're an adult, you're moving forward. So use this tool, use these things to give you the best chance so you're not diminished as you age because of a preventable illness you didn't have to have if only you got yourselves vaccinated. So, once you get sick, it's hard to turn it back. So I really like your point. Allison, what do you come up with?
Well, something we haven't talked on tonight is vaccines can be a little bit uncomfortable for some people. And that little bit of discomfort of getting that vaccine is going to protect you a whole lot more in the long run. So you won't get one of these vaccine preventable diseases. So just take a deep breath, go ahead and be prepared to get that vaccine. I still want to add with my tagline, vaccines prevent disease or lessen the complications for those preventable diseases. And don't forget to go ahead, ask questions from your healthcare professionals, whether it's your pharmacist, your physician, your nurse practitioner.
And if they don't want to answer your question, you got the wrong professional. If you go to a pharmacist and they don't have time for you, there's another pharmacist around the corner. Go to them, because you don't have time to play around with your health with people that don't love you. Love the person that loves you. Candace, last word.
Yeah, absolutely. I think kind of to end where we started, vaccinations are critical components of routine healthcare for adults. And so all too often, though, we see adults miss the opportunity for vaccination despite being increasingly susceptible to immune decline and infectious diseases and at greater risk for chronic conditions. So adults should really talk to their doctor, talk to their nurse, talk to their pharmacist about which vaccinations they may be recommended to receive.
I love it. And I'll just make one last word as adults. Adults, we need to love our children in addition to ourselves. Let's make sure that we protect our health so that we can protect our kids. Let's be there for our families by being as healthy as we can. But also, because we love our kids, let's also make sure that once we get ourselves vaccinated, we take our children to get themselves vaccinated. I think all of you are aware there is a huge attack being made on children's vaccines. And as a result, unfortunately, childhood diseases that had been long, prevented and weren't even on the radar anymore, things like polio, are now coming back because of these, I have to be careful of the words that I use, but these people who are deliberately trying to cause our parents not to get our children vaccinated. We cannot afford that, and particularly in the Black community. So let's make sure that we are taking the time to take care of ourselves so we can take care of our kids, and then let's get our kids vaccinated as well. We're all in this together. This is a health journey. And as we talked about with things like shingles, the disease starts when you're young, stays with you, and then comes back and says hello again when you get older. This is a continuous journey. Thanks to our panel so very much. Each of you are just so very special. And I want to thank our sponsor as well, Bio, for giving us the opportunity to put this program on. And above all, let me thank our colleagues at blackdoctor.org. This is the place to go if you want trustworthy, reliable, actionable, relevant information for the Black community and for all Americans in general. Have a good night, everybody. Take care. Bye-bye.